welcome to Unit 6, the last unit of the Family Life Education. Unit 6, we are going to look at diseases related to living habits. We'll begin by looking at the session 1, which has to do with drugs and medicines. By the end of the session, you'll be able to explain uses of drugs as medicines, identify factors that contribute to effectiveness of drugs, differentiate between prescription and non-prescription medicines, and explain how to ensure safety use of medicines. Now we are looking at uses of drugs as medicines, and we need to understand some of the terms being used. So first look at drug use. When we say drug use, it's the taking of drug as medicine correctly, and that is for its proper medical purpose and in the right amount, frequency, strength, and manner. People take in drug for different purposes. So we are saying that when you take in drug correctly and with the right purpose, then we say it is drug use. Many people also believe that drugs can cure diseases. Drugs as chemicals may be used by individuals for different purposes, as I mentioned earlier on. So people take in drugs not because they want to cure diseases, but they take it in. For example, people take in some drugs with the mindset that it's going to increase their performance in some activities that they undertake. What then is drug? We've looked at what drug use is, and we want to look at what drug is. Drug is any natural or artificial substance which is used as a medicine, and a drug can also be taken for pleasure, to improve someone's performance of an activity, or because a person cannot stop using it. The individual becomes addicted and continues to use that drug. A medicine is also a substance that can be used for the treatment of illness or injury. So when you use medicine, when you use any substance with the idea that you are using it to treat a disease, illness, or any injury, then we say it is called medicine. Some can be swallowed, some also come in the form of liquids which we drink them. The medicines have a lot of benefits, and we say they help to prevent diseases. For example, the vaccines that we normally take, the immunization that children have to take, prevent them from getting diseases. So you remember that there's the childhood diseases. We take in some medicines with the aim of preventing such disease from occurring. And drugs such as artesunate, those that we use in treating malaria, we say it kills the bacteria that causes malaria. And this is an example of drugs that are used to cure diseases. Drugs also make diseases less severe without helping to cure them. Examples are steroid hormones, which reinforce the body's defenses against incurable diseases such as arthritis. So some of the drugs we take in order to reduce the pain that the individual goes through. So not necessarily that is going to cure the disease, but it's going to reduce the severity of the impact of that disease on the individual. Sometimes they may also relieve symptoms, something like the paracetamol that we all abuse, aspirin, brufen, and then many others. There are certain points that we have to bear in mind whilst we use drugs. All drugs, whether used medically or abused, affect the users physically. And so we are saying that drug has a lot of effects on the individual, and their use may involve some risks. For example, many drugs may impair driving. So sometimes some of the drugs, like those that we use to cure cold, sometimes the inscription on the leaflet tells us that when you even take such drugs, you cannot do what? You cannot drive. And then all drugs have many effects All of them occur when you take the drugs, whether you expect them and want them to occur or not. There are side effects of every drug, and we can see some of the side effects on the leaflet of such drugs. Let us look at some of the factors that contribute to drug effectiveness. So if we are considering any drug to be very effective, there are some factors that we have to bear in mind. One factor is the nature of the drug itself. And so the nature determines the effectiveness of the drug. Another has to do with the form. Are we taking it in the form of liquid? Is it in the form of capsules or tablets? Research has actually indicated that drugs that are in the form of liquid works very fast than the capsules or tablets that would have to dissolve before the impact is felt. So the forms will also determine the effectiveness of that drug. And then again, when you take the drug, that is the timing of the drug. When you take it is also another factor. For example, is it before meal? Is it after meal? That is why sometimes when we even take prescriptions, we are being told when we should take those drugs. Certain drugs work very well when we've taken in something. Others too work very well in the stomach when there is nothing. So when you take that drug, determines its effectiveness. Another factor is your body and then the mind. Here we are looking at your age, your weight. And so you realize that when you are young, anytime you are giving medicine, it works faster. When you advance in ages, it takes a very long time for the same medicine to work very effective on you. And probably the strongest factor affecting actions of medicine is the use of other drugs. They may slow down one another's absorption. When you take in drugs and probably you are taking others with a combination of other drugs, there are certain drugs that when you take together, the other one becomes less effective. So that one also contributes to the effectiveness of the use of drug. And then we also look at the route by which the drug is taken. Is it through the mouth or is it injected? It is believed that drugs that are injected straight away into the bloodstream work faster than those that are taken, which takes through the mouth and then has to go through the digestive system. And so those that are injected work very fast. Let us look at previous use of drugs and other drug use. A drug may produce one set of effects when it is used for just few days, but produce an entirely different effect when used over a long period of time. And here we are talking about weeks, we are talking about months, and we are talking about years. And oftentimes after taking a drug for a long time, a person may need higher doses to achieve the desired effect. This is because the body has developed tolerance. That is why sometimes when you take some medicine, especially those that we use in treating malaria, when you take one for a very long time, you realize that the bacteria may develop some absorbers to that, and therefore when you continue to take it, it might not be effective as taking a different one. So most of the time when you take one kind of medicine for a longer period of time, sometimes in other times they are being changed for you. This means that the body has become used to the drug being exposed to, and so the bacteria have developed resistance to those substances in the drugs. The longer one takes the drug, the better the body becomes used at breaking down the drug, and the faster it gets rid of it. And many organs also work together on this. We also want to look at drug use. Drugs also interact, and sometimes such situations benefit the user, but it could also be dangerous to the person. And so when you take two drugs or more, they interact, and we are saying that if you don't take care, it could be dangerous to you. And taking it together, we are saying that many of them produce a new or stronger effect with what we call the drug synergy. And then either the drug can produce alone, and sometimes this is beneficial as medicines are intended to work together to cure an illness. Other times too, the interactions are dangerous as when pills and alcohol are combined. And so there are certain drugs that you cannot combine because the impact or the effect will be very negative. That is why it is always advised that you take medicines that have been prescribed by a medical practitioner. One drug can also prevent the action of acting as antagonists. Such drugs are useful in the treatment of accidental overdoses or poisonings. So such drugs, that is what we use in treating. And drugs that block the action of snake venoms are examples of such antagonistic drugs. Some form of addiction treatment also use antagonistic drugs to oppose the effectiveness of the addictive drugs. Among the safest drugs are many antibiotics. Antibiotic drugs stop all living cells from dividing. Now we want to shift to what non-prescription and then prescriptive drugs are based on our objective. Medicines have been divided into two classes. We have those that are prescribed and those that are not prescribed. Normally, those that are not prescribed, we call them over-the-counter medicines. And so when you move to the drugstore, whatever we call it, and then you buy medicines based on previous experience, probably you got sick and then some prescriptions were made. And when the same sickness comes again, without seeing a doctor, you want to go to over-the-counter to buy it. We say such medicines are not prescribed, and we call them over-the-counter medicines or non-prescription. Those that you cannot just go to the counter and buy them, but it is solely prescribed by a medical practitioner, is what we call the prescription medicine. How do we choose over-the-counter drug wisely? We are saying that sometimes we cannot avoid it at all. Sometimes you need to relieve some sort of pains, and without a prescription. One of the drugs that I always use as an example is the paracetamol, which we all abuse. So sometimes there is a need to get over-the-counter drugs, but then we are saying that you should be very wise in choosing them. So when you are choosing them, you need to read the labels, and by reading the labels of non-prescription drugs, you can protect yourself against ingredients that may be harmful to your body. Some of us we have allergies, and so till you read the labels of such drugs, you cannot tell whether there is a substance within the drug that you are allergic to. So reading to get the substances or what they use in preparing that drug is very important. You also have to get the generic and the brand names. Both non-prescriptive and then prescriptive medicines are referred to by two terms. First, we have the generic names, and then second, we have the brand names. The generic names are the chemical names of the drugs, and these generic names never begin with capital letters. We should bear in mind. And the brand names are names given to the drugs by the companies, and they are always capitalized. So we have to bear that in mind so that we can determine where the generic and the brand names of such drugs. We have already said that with the prescription medicine, it is a medical practitioner, a doctor has prescribed it based on the diseases that we take to the hospitals or health facilities. And we are saying that they may be dangerous or have serious side effects and can be misused with serious consequences. Although they are being prescribed for us, sometimes we also need to look at the prescription, how we should take it, so that we will minimize the side effects that we'll experience. So you can read more in your books to get more information about what you have to look at when you have been given prescription. You say sometimes some of the things that you have to look has to do with the name and the nature of your condition. Be aware of that. The name of the prescribed medicine, whether the doctor prescribed the generic version of the drug. As we mentioned, we have the generic and then the brand name. Was it what was prescribed to you? How often, how long, and in what doses are you supposed to take it? Sometimes we are given prescription and then we go our own way and take it as how we want it. Even how should you take it? Is it before meal? When? Is it before or after meal? We have to take all these into consideration. Now let us look at some of the health strategies for taking drugs safely. First of all, you need to check your doctor or the pharmacist before substituting a generic drug with brand name prescription drug. And then you also need to read and follow instructions. We have mentioned this. And always you see some leaflets attached to them. Read it carefully, and this will tell you about the drug, how it is taken, the effects and the conditions under which you should take the medicine. They are all supposed to be read so that we follow it in order to use drug safely. And do not share prescription drugs with other people who seem to have the same illness as you. You see, we know two people are the same. Irrespective of the symptoms that you are all exhibiting, especially within the family, we think that when A experienced disease B and the person went to the hospital, drug A was given, and so we just take it without the prescription. We say we shouldn't do that. And then we should be careful. We should not mix drugs anyhow, especially over-the-counter drugs that we take. And then as much as possible, you also need to avoid alcohol when using drugs. Throw away any unused drug, especially when you have given the number of days that you have to take them. You need to throw them away when you have exhausted the period. They say 2 weeks. After 2 weeks, please dispose it off. And then you also need to check the expiring dates. When you check the expiring date and they are expired, you don't have to use it. And then you also have to check where you store such drugs. And store drugs in a cool, dark place. And be careful about the drugs that have been left around or exposed to the sun or heat. That is why sometimes you should be careful. Drugs that they sell in buses, and they are all classified as over-the-counter because it is non-prescribed by any medical officer. Inform your doctor if drug does not seem to work the way you expect it to. Inform your doctor if you also experience any reactions or side effects. And make sure that you keep all drugs in their original containers. When taking drug at night, turn on the light to see the label, and then you need to read the inscription on it, taking care of the dose that you have to take. And then take the entire prescription of medicine. So when a medicine is prescribed to you, you need to take everything. Don't say that I am feeling better, so I want to stop. It is a course they have given you, so you need to take it. And then take the entire prescription of medicine. We have said that keep all drugs away from children. A story is said, sometimes those that they think is so sweet is there, and then children will go and take them to abuse them. You need to be very mindful of that. To end it, we are saying that drug, when used to prevent or improve health conditions, we have two ways. We have over-the-counter, and then we have those that have been prescribed by a doctor. Again, a lot of factors also contribute to the effectiveness of drugs, and therefore whenever we are taking in drugs, we need to consider all these factors. Thank you.